What is hemoglobin A1C? Hemoglobin A1C is a blood test that shows what your average blood sugar level has been for the past 2 to 3 months. Doctors and nurses use this test for two reasons. First, to see whether a person has diabetes. Second, to see whether diabetes treatment is working the right way. Other names of hemoglobin A1C are glycated hemoglobin, HbA1c, or just A1C. What should my A1C numbers be? Now, A1C numbers, it depends on two things. If you are checking for diabetes, if you have an A1C test to see if you have diabetes, your A1C should be 6 or less. If your A1C is 6.5 or higher, it probably means you have diabetes, but you should have the test done again to be sure. If A1C is between 5.7 and 6.4, you are at risk for getting diabetes. You should probably start doing things that can help prevent diabetes. For example, you should become more active or lose weight if you are overweight. Second, when checking how treatment is working. If you already know you have diabetes and you had an A1C test to see how well controlled your blood sugar is, your A1C should probably be 7 or less. But you need to check with your doctor on what your level should be. Not everyone with diabetes is the same. Same people need to aim for different A1C levels than others. Can I do this test at home? It is now possible to buy kits to test your A1C at home, but home testing of A1C is not usually necessary. How often should I have an A1C test? That depends on whether you have diabetes and on what your last A1C test showed. If you had an A1C test to check for diabetes and your A1C was less than 5.7, meaning you do not have diabetes, you should have A1C test done every 3 years. If you had an A1C test to check for diabetes and your A1C was between 5.7 and 6.4, meaning you do not have diabetes but are at risk for it, you should have A1C test done every 1 to 2 years. If you do have diabetes and your blood sugar is well controlled, you should have A1C test every 6 months. If you have diabetes and you recently changed treatment plans or you are having trouble controlling your blood sugar, you should have A1C test every 3 months. Why do my A1C numbers matter? A study shows that keeping A1C numbers close to normal helps keep people from getting first diabetic retinopathy, an eye disease that can cause blindness, nerve damage caused by diabetes, also called neuropathy, kidney diseases. For people with newly diagnosed diabetes, keeping the A1C close to normal might also prevent heart attack and strokes in the future. Do I still need to measure my blood sugar at home? If your doctor wants you to check your blood sugar at home, you should keep doing so even if you have routine to stay as healthy as possible. If I have diabetes. If you have diabetes, sometimes called as diabetes mellitus, the most important thing you can do is to control your ABCs. A stands for A1C, B stands for blood pressure, C stands for cholesterol. A1C is blood test that shows what your average blood sugar level has been during the last few months. B stands for blood pressure. If you have diabetes, controlling your blood pressure is just as important as controlling your blood sugar. High blood pressure puts you at risk for heartbreak, heart attack, stroke, and kidney disease. C stands for cholesterol. Cholesterol is a waxy substance found in blood. High cholesterol is another factor that increases your risk for heart attacks, strokes, and other serious problems. Why are my ABCs so important? Compared with people who do not have diabetes, people who have diabetes are 2 to 3 times more likely to have heart attack or a stroke. People with diabetes also have heart attacks at a younger age, and that are more severe and more deadly. Plus, people with diabetes are much more likely to get kidney disease. By keeping your ABCs under control, you can lower your risk for these problems by a lot. Isn't my blood sugar the most important thing? Keeping blood sugar low is important in preventing some problems caused by diabetes, including eye diseases that lead to vision loss or blindness, kidney disease, nerve damage called as neuropathy that can cause numbness or pain in hands and feet, the need to have toes, fingers, or other body parts removed by surgery or amputation. Even so, blood sugar is just one of the things that should get your attention. That is because the problem caused by high blood pressure and high cholesterol are often more serious than the ones caused by high blood sugar. What should my ABC levels be? The levels you should aim for will depend on how severe your diabetes is, how old you are, and what other health problems you have. Ask your doctor or nurse what your target levels should be. Many people with diabetes aim for A1C level below 7%, blood pressure below 140 over 90 or lower in some cases. LDL cholesterol is below 100. LDL is one type of cholesterol often called as bad cholesterol or lousy cholesterol. How can I control my ABCs? You and your doctor will work together to create a plan to keep your ABCs under control. Your plan might include medicine, lifestyle changes. In medicine, most people with diabetes take medicines every day to control their blood sugar. They might also need to check blood sugar levels every day. Plus, many people with diabetes need medicines every day to treat high blood pressure or high cholesterol or to prevent future health problems. If you have any problems with your medicines or you cannot afford them, talk to your doctor or nurse about these issues. Lifestyle changes, choices you make every day about the foods you eat and the way you live have a very big impact on your ABCs and your general health. Here are some things you can do to help keep your ABCs